My name is Al Silva. I'm a retired Marine of 27 years, and with all the military service comes issues, and back and neck pain was one of them, and that's what brought me here to the Kalani Total Health Center. I've been a patient since June of 2011. I was referred in the office by the brochure that Dr. Kalani would put in the Sunday paper, a picture of his family and a list of all the different things and how he got into chiropractic. And finally, I made the leap, and the rest is history. A random lower back pain, mid shoulder blade back pain, some neck discomfort just from years of military service, and normal wear and tear on the body. And thought chiropractic may be an option because the medical side, they want to put you on all the pharmaceutical things and muscle relaxers, and I didn't want to go down that route. I want to try an alternative approach, and chiropractic was one of the next best things. I had known somebody that had come through Kalani at one time prior to me coming here, so I remembered that they said about the place, and then when I got the flyer in the Sunday paper, everything else just kind of gelled together. Staff here is great. I've seen them come and go since I've been a patient. Some takes a unique individual to be part of the Kalani Health enterprise that you have going here, and everyone's very friendly. I mean, you got some of the nicest people on the face of the earth that work here. The staff, the medical professionals, and the nutritionists and the acupuncturists, and all those people are very professional in their duties and helping the people out. They're friendly. You're greeted when you come in. You're greeted when you leave, and sometimes you don't want to leave because the staff is tremendously friendly and warm, and you want to come here. It's not like a sterile doctor's office where you're a number or a patient, or they see you and then they forget about you, or you show up and they don't remember what you're there for, or oh, we had to cancel your appointment, didn't we call you? It's not like that here. Here they follow up with you all the time, and if something changes, they're on the phone, making changes right then and there. They don't stop until they reach you as the person, not just leaving a message. So very friendly and warm atmosphere. I've done most of the treatments. I've acupuncture. I've done the adjustments protocol. I've done the CFR treatment with the nasal passages, and that helped breathing. Did that, and it was a very interesting experience with Dr. Allen. Very interesting, but it wasn't as horrible as I thought it was going to be. It did help. I'm breathing a little better, and probably due for another round of it. But definitely something, not for the squeamish at first, but it's not bad. Before I came into this chiropractic office, while I was on active duty, they do have a chiropractor at Camp Pendleton. They do have one out in 29 Palms at the Naval Hospital, but they're very limited. They come once, maybe twice a week. They're there for 8 hours. They fill up fast, but luckily I was able to get in and keep a recurring schedule. So I was probably going once every 2 weeks to the chiropractor out in 29 Palms. They do it the approach is differently. They put you on a table, and it's like a vibrating table with a roller to loosen you up, and then the chiropractor comes in, and the way they do their adjustments are totally different from how it's done here. So kind of a totally different thing. But I like it here. It's more consistent, and I kind of know what I'm getting with each doctor versus, what's the big surprise for today before. But as I've come here, I've obviously I feel a lot better. My back, my shoulders, and the pain is pretty much gone through my regular maintenance. If I did have any pain or discomfort, it showed me unique stretching exercises to do to alleviate that, along with the adjustment, the proper use of the heat and the ice and the different ointments to, for temporary relief, and how to stretch it. I've also taken advantage of the nutritionist that they have here on staff, which is huge. A year ago, I'm on day 367 of my 21-day challenge. I've lost about 45 pounds in the last year, just doing the nutrition and listen. I have a binder here, which I brought with me to show that I keep a record of everything I do with Kalani Chiropractic. So I take notes of everything, every time I go to a different procedure that they're doing here, or I sit down with Kristen, the nutritionist, and showing you how to eat right, and getting you on the right path for living a long life. And life is not a sprint, but a marathon. I want to finish the marathon. For a new patient, have an open mind. You're coming here, you probably have issues that you're trying to deal with. You have a lifestyle that you're accustomed to, and they're going to make recommendations that may go totally the other way of what you're accustomed to. You just have to remain open mind and give things a try and give the corrective care a try. It takes time to get to where you want to be, but it's a positive attitude and thinking about the big picture, your life. You want to spend more time with your family, but you want to be with your family 20, 30 years down the road as well. Be there for your grandchildren or your children and watch them grow up. So that's very important. But when you initially come in, you're probably nervous. They don't do anything crazy, all right? They're not going to twist you up like a pretzel and spin you around and snap, crackle, pop. You may get the snap and crackle and a little pop here and there, but that's just your body getting used to it, and let them guide you through. And it's usually the rewards far outweigh anything that's negative.